Have you ever caught your reflection and thought, wait, when did that happen? The fine lines, the tired look that sleep doesn't fix, the skin that just feels different. If that sounds familiar, you're not alone, and today's episode is for you. Since launching this podcast, I've had the chance to speak with some truly incredible experts, and in this special mashup, we're diving into one of the most misunderstood and often taboo topics, aging. You'll hear from dermatologists, hormone specialists, and skin experts breaking down why your face starts to change, from collagen loss to shifting bone structure, how hormones like estrogen impact your skin after 40, and how to navigate aging in a way that feels empowering, not defeating. Whether you're team retinol, team filler, or just team I want to feel good in my skin again, this episode will give you clarity, confidence, and maybe even a little self-compassion. Let's get into it. So today I thought I would talk a little bit about what's happening with your skin and your face as you begin to age. We've had a few people ask us what on earth's going on with their skin in the perimenopause and the postmenopause. So I thought I would incorporate a little bit of that as well. So if we think about our faces, first of all, your facial structure obviously gets to a certain point in early adulthood, and then you would think it pretty much stayed the same because you've finished growing, etc. But actually that's not the case. And as we age, lots of bony changes happen in the face, particularly from the sort of 40s and 50s onwards. And we get changes around the eye area, the orbit, and the bony orbit becomes bigger. And that often starts to give us that sort of sunken appearance. We get changes in the cheek, and the cheek begins to flatten in the bone structure. And we also get changes in our jaw and teeth. And that's one of the reasons why it's important to try and hold on to as many of your own teeth as you can, because obviously whenever you lose teeth, you get some bone resorption, and that actually changes the shape of your face. So facial shape is changing due to bony loss. And then the next layer really in the face is muscle. And we've obviously got lots of muscle that allows us to make all the expressions. So it allows you to speak, talk, chew, laugh, smile, raise your eyebrows, smile at people, lots of interaction. And then also those sort of more negative things. So sometimes we end up clenching our jaw or grinding our teeth, and that's all related to muscle. And the muscles with age also do tend to get a bit smaller, they get a little bit more lax, and again that starts to change the shape of the face. And then the next layers are what are called our fat pads, and we've got a deep layer of fat pads and a thin layer of fat pads, and everyone has fat pads. It's nothing to do with being fat per se, and we need to have the fat pads in our face. It allows the skin and everything to sit nicely. As we age, those fat pads actually really begin to deteriorate and shrink in certain levels. And in the superficial or top layer, they tend to droop a little bit. And so if you think about all those layers, and we haven't even talked about skin yet, so we've got sort of bone slightly disappearing and changing shape. We've got muscles shrinking. We've got fat pads deteriorating and slipping, and all of that starts to cause this heaviness in the face. So when we think of a young face, we think of it as being a bit heart-shaped, so kind of in theory with that pointiness at the chin. And then as we begin to age, more and more I see women in their 40s and 50s, they'll come into the clinic and they don't like this area here, and that's because the face is beginning to square off. And what you see on the surface is a reflection of what's happening in all of those layers of the face. And then, of course, we've also got the skin. So when we begin to age from a skin perspective, and that's in the 20s, we have less collagen and elastin in our skin. And that is definitely accelerated for those of us who are living in Australia. So unfortunately, aging is actually really quite accelerated here because of the amount of UV damage. And I have to admit, when I first moved here from Ireland, it was something that I did notice nearly immediately, is that unfortunately people's skin looked a bit older than they actually were in their biological age, so that their skin was older than they were. And that's all thanks to that sun that we all enjoy and have such a great life outside with. But the reality is it's so damaging to the skin. And I do think that we've probably done quite a good job of explaining to people that too much sun puts you at risk of skin cancer. And most people know that those sort of dark and age spots on their face are also caused by the sun. But what I think a lot of people don't understand really is the aging effect of the sun. And it really is quite considerable. If you're also perimenopausal or postmenopausal woman, you've either got very deteriorating and dropping levels of estrogen in your skin, and then you've also got in the postmenopause basically no estrogen in your body. And what we know is that in the skin there are estrogen receptors that play an important role in things like hydration of the skin, in terms of collagen and elastin. And so estrogen is very, very fundamental to the skin. It's also got a very big anti-inflammatory property. So if we think about what's going on in the skin, as I said, when you're in your 20s, it begins to happen. So collagen is something that's always being sort of made, but basically as you start to age, per year, you probably make about 1% per year less than you need in your 20s onwards. And then what we know is that in the postmenopause, that accelerates and is probably on average about 2% per year of deficit. So, you can know after 20, 30 years, that really is beginning to add up. We also know that women have a real double whammy. So sometime around the menopause, women can get a drop of up to 30% of their loss of collagen. And that's why I often have women come into the clinic. They invariably have a photo of themselves from 2 or 3 years before, and they often feel like they're really unrecognizable, or they feel like they've just aged overnight. And although it hasn't been quite an overnight aging process, it's certainly something that has happened reasonably dramatically in a short period of time. And they're absolutely right. They have had a real fall off a cliff of their collagen and elastin. And I want you to think of collagen and elastin a little bit like a really nice rubber band. So, if you had a rubber band and you're playing with a rubber band or an elastic as a child, you can stretch it and it just keeps going back to its original size. But if you found an old rubber band that had maybe been in the drawer for 5 or 10 years and you took it out, it was likely to be a little bit hard, a little bit mangled, and if you tried to stretch it, it's likely to snap. That's a little bit like what's happening with your collagen and elastin. So you no longer have that elasticity of the skin. So whenever you're younger and you're smiling or scrunching up your eyes or raising your forehead, you've got this lovely, thick, plump skin, and you just contract your muscle and then relax, and there's no line left behind. But as you're aging, basically your skin is thinner, it's drier, and those lines are becoming more like folds in a piece of paper. So in terms of aging and facial changes, yes, you are right. There are things that seem to be happening a little bit more quickly than you'd like them to be. Yes, it's not too late to start wearing sun protection every day. It really, really does make a difference. I have to say the other thing that's really noticeable, particularly here in Australia, is although it's really hot and sunny a lot of the time, I find that so many people do not wear UV protection every day. They'll often say things to me like, oh, I wear it when I go to the beach, or I wear it when I go for a walk, but they don't wear it whenever they are in the car or driving to work or walking to the train station. And what I will tell you is, without shadow of a doubt, we do a full skin assessment on everyone who comes to our clinic. And we use a piece of equipment that does a special type of photography that lets me see the sun damage. And invariably, in anyone who drives a car, the sun damage on their face is always so much worse on the right. It's very, very obvious. Anyone can see it. The patient themselves often remark, oh my goodness, look how much worse it is on the right. And obviously, if I lived in the US or in France or somewhere where they drive on the other side of the road, I suspect it would definitely be on the other side as well. So I want you to really think about the things that you can change. And that's one of them. You should be wearing sun protection every day, because, if you sit at a desk in an office and there's a nice window with the sun shining in, it's damaging your skin. If you're driving to work or sitting on the train and the sun is shining in, it's damaging your skin. So definitely UV protection is something that you can control. There's no doubt that in the Perimenopause and postmenopause, because your skin is drying out, there's a real drop in the amount of hyaluronic acid in the skin that we probably do really need to supplement that in terms of using a serum, more moisturizers, and particularly as we get into the cooler months of the year, really bumping up the sort of the richness of the hydration we're putting into the skin, both on the skin and of course making sure that we're drinking enough fluid as well. The other things with regards to bony changes and muscle changes, look, to be honest, there's really not much that you can do to prevent those. They often have a genetic element, and there's something that just happen with aging. However, there are some treatments that do help with those, but they're very individualized, and I think it's something that I'd rather have a one-to-one conversation with people about. So look, I'm hoping that that's helping you understand that it's not just saggy skin that's making you feel like your face looks a bit different. And it's not just that a bit of skin tightening is going to take it all away. Unfortunately, that's not the case. And as much as I love a bit of skin tightening as much as the next person, it really is the whole depth of the face that's changing. And we need to keep that in mind whenever we're trying to think of a solution. So I hope that helps. Hopefully you get to understand a little bit more what's going on in your face. And as they say, knowledge is power, and it gives you the power to go and do something about it. One of the reasons I went into aesthetics is I didn't really like the aesthetics industry. I didn't like the way things were done. But what I will say is, because it's $1 trillion industry, there is some incredible, absolutely incredible products and research and development. And actually, if it's done by the right hands, you can get incredible results with really subtle rejuvenation. And I can see people's confidence just absolutely grow. So without further ado, I'm going to hand over to my husband, Dr. Peter.
So yes, facial aging in the perimenopause. Unfortunately, there's a little bit of an acceleration in facial aging through that period of your lives. And the reasons for this are skin thinning, skin dullness, and accelerated volume loss. And the accelerated volume loss does cause the mid-face to drop a little bit, and you get a bit of lower face heaviness, which we all generally notice. We talked about the aesthetic triangle in the past, and just to touch on it again, and people may have heard of it. Whenever you're 25, you've got lovely mid-face volume. It's all cheekbones and shadows and reflection and jaw shadows and transitions into the neck, all really nice. And then as we age, we get that lower face heaviness as that mid-face volume depletes and then drops. So why does this happen? So we talked, there's a bit of overlap, of course, in all these talks, but we do lose the fat in the face and we lose the bone. But bone loss is quite steady through the menopause. It's not bone density, which is different. That was touched on by Nicole. So this is bone loss where the actual volume of the bone deteriorates, and that can be around the orbits or around the nose, around the angle of the jaw. And of course, then the balloon deflates a little bit and there's a little bit more laxity on the skin surface. The fat loss, unfortunately, it happens in this mid-face area in both men and women. So in men, the fat goes down and you look more masculine. In ladies, the fat goes down and you look more masculine. So that's really unfortunate. However, the other big cause of volume loss in the perimenopausal time is hyaluronic acid loss. And we've all heard of hyaluronic acid through serums and lots of different things. Even fish oil capsules have hyaluronic acid, eye drops, everything. But it takes a substantial volume loss around the perimenopause as well. Facial volume loss does happen quite early, around the age of 35, which is a little bit depressing. And around 50 years old or the menopause, it can be as much as a teaspoon or more per year. So 6 mils a year, every year as you get older. It is quite a lot, and it does eventually take its toll on how we look. So there we are, the bone and the fat loss steady, a steady line through, and then the hyaluronic acid just literally drops off a waterfall or drops off a cliff, which is very annoying. So is this bad news for everybody? Well, it isn't necessarily bad news. It does depend on a lot of things. It depends on your personality. It depends on a lot of other stresses in your life. But it certainly does tend to have an effect about how you feel about yourself. And I can stop my talk right here if we just banned mirrors completely. But of course, it does add to the other symptoms. And Shauna talked about a lot of symptoms in the perimenopausal time. And everything then just adds together to create a synergistic effect, and you get a bigger number at the end of it. And it just all adds to sometimes a deterioration in your general well-being. So a lot of people do wonder about, is this okay to treat? And Shauna just touched on that. People talk about vanity, like Shauna mentioned, but, is there a crossover between self-esteem, really? Because whenever you get that volume loss and you start to look a little bit more aged more quickly, then it does have an impact on how we feel about ourselves. The other thing I'm really quite big into is aesthetic versus cosmetic. So you see cosmetic clinics, and then we call ourselves an aesthetic clinic. And what really is the difference? And aesthetics is really a philosophical term about how you perceive beauty. It can be anything and anybody, whereas cosmetic is a term that's really to do with, the surface of everything. And it doesn't really reflect truly what's going on underneath, whether that's psychological or physical or everything else that goes along with it. So one thing whenever I do consult with patients is they do use this word busy. And before COVID, interestingly, busy was a term that was nearly like a badge of honor for men and women. But now it's just like, I am exhausted. I am too busy. I just cannot get this balance right. And so as a man, I've definitely observed that ladies are in a slightly different boat than men about this. And I always talk about the 24/7 job that ladies have, regardless of whether they have an actual profession or job or career. It's still just mayhem in your lives, looking after everybody that's in your family, whether that's a carer's role with a relative, kids, of course, looking after their husband. He, I'm sure, is a great guy and does a lot of dishes, etc., etc. Do tend to neglect your own well-being until sometimes you come along and go, now might be the time to look at this. And so it's really nice to have those conversations. But where do you start? And so it doesn't mean that you actually have to do anything. It just means that you have to sort of arm yourself with the knowledge. And it's the same as the hormones. If you can arm with yourself with the correct knowledge, then you can make the correct decisions for yourself as an individual. Nobody's going to force you to do anything that you don't want to do. You want to get knowledge that doesn't overwhelm you, because whenever you Google it or look around at where's the best place to go, can be quite overwhelming. So there is a clinic nearby. This, where I'm standing right now, it's a clinic that is quite good, I reckon. It's not far from here. Might know it. And so we would like you to get some good knowledge from us, never feel under pressure from then you can make decisions that are right for you. And we always like to say that you're the expert in yourselves, and we are hopefully experts in some of the things that we do, or all of the things we do. And then two experts putting their heads together, you can come to some really nice solutions that address your own concerns. And we just want to keep it natural and super safe, and that you're in control of your own journey. So we do a doctor-patient consultation, and it is really good fun, especially for me, because people do this, and then we sort of just chat for a while, and we then come to a decision on what will be the best way forward to help your concerns. But so many people have done this maneuver where they've just sort of pulled everything back up. And what they're doing is just restoring that mid-face volume that we unfortunately have lost as we've aged. So another frequent comment used, obviously, yes, with the best of intentions, nobody's saying it in a bad way about their dear mum, is that they're starting to look like their mum. And with the menopause, it's funny that, not funny, but it happens very quickly. And that's that hyaluronic acid drop off, which really plummets so quickly that you get this sort of aging look really quite quickly. Whereas in your 30s and early 40s, it just seems to take a natural course. So the hyaluronic acid drop off is one of the causes of that. So we want to explore the right solution for you. Of course, hormones are being touched on a lot, and absolutely what you want to arm yourself with the correct knowledge about what's right for you in that direction. Skincare, which is brilliant. I mean, if all you did was skincare, you do an awful lot for yourself. There's dermal treatments, so nobody ever has to touch you with a needle at all. But of course, then there are injectables, so I'll just touch on a few of those. The other thing is that if you do a few things together, again, you'll get this 1 + 1 = 3 effect, and you'll get a better result. And hopefully start feeling a little bit better about yourself. So which one could be right for you? There's anti-wrinkle injections. Some of you may have had them. There's other things like dermal filler we'll touch on, which sometimes people find is a little bit confronting to start with. And then there's other natural things like skin boosters, which are although they're an injectable, they're very safe, and they do some really nice work on the sort of surface levels and collagen and sort of skin plumping. Platelet-rich plasma, I'm not sure if any of you have heard of that, but it's another injectable, but it's your own platelets from your own body, which are re-injected back into various areas of your body. We'll talk about your face tonight, but they're super safe. And if you have a reasonably healthy diet, it's amazing. The platelets and the plasma have just so many growth factors, and they can do some amazing things. So what we want to do is quite simply flip your aesthetic triangle back. So it's simple as that. Pretty easy. Well, sometimes it is, but we just want to keep it really, really natural. So this lady's 80 years old. I just saw her last week, and she's had a 6-month journey. She doesn't want to look 25 again. She might want to be 25 again and look 25 if she is 25. But most people just generally want a freshening up that reflects their physical fitness, because there's so many people of this age who are still knocking out 18 holes of golf 3 times a week and are very fit and well. So we really want a nice, subtle, natural look. And you can just see in the second picture, she does have a little bit of lipstick on. And she looks like she doesn't mind getting the photograph taken just so much. The first photographs are always horrible to get done. Everybody hates them, but she's used to, this lady's used to us by now. But she does look a little bit happier as well, which is great. So replacing the volume, there's various injectables that can do that. And at our clinic, our mainstay are replacing that hyaluronic acid volume loss, which can be done through a bioremodeling injection called Profhilo, which we'll talk about. And then, of course, there's the little filler chat that we're going to have as well. So bioremodeling, it is very pure hyaluronic acid. It's really, really safe. I always say you could give it to your kids, really. It is an injectable, but it is just super safe. There's no chemicals in it, but it does an amazing thing because it does 3 things, and most treatments do one thing and then you do another thing that adds to it. But Profhilo in itself does 3 things. It does a little bit of volume restoration. It thickens the skin and collagenizes the skin. But interestingly, it reactivates your anti-aging pathways, which is fantastic. So you start a little treatment regime and then you just get a booster forever and ever, and you'll keep getting younger up to a point. I reckon the aging process might win eventually. But it's delivered, it is an injectable, 10 small injections. It's very, very quick, but it is not a filler. So that's what I was just saying there. It does three things, which is great, and that's quite unusual. So this was actually after this lady's first set of injections. She'd come back for her second set. And you can see in the first picture there's definitely just a little bit of skin brightening. This lady's not doing anything else apart from a nice bit of skin care. And you can just see her tear troughs look a little bit more restored, and she looks a bit fresher and more youthful, and even really nice whenever she smiles there. That skin brightening and just that mid-face revolumization is really nice. This lady here, whoa, it was a serious business having a chat with her to start with. But I put this gentleman's picture in because it's not just for ladies, this. It actually is really good for men. And we can, always very hard to standardize pictures. But what I was interested in with this gentleman is that he was trusting the journey. And he's definitely looking younger 18 months on. It's brilliant. He's getting his boosters. He's trusting the doctor who's giving them to him, which is me, strangely. And he's really happy with the results. But they're nice and gentle and subtle. So I really love Profhilo, and I do think that if anybody is interested in the injectable component, it should be considered as part of an anti-aging journey, particularly around the perimenopause. So some thoughts on dermal fillers. Everybody has a little bit of a perception maybe of dermal fillers. Some people are happy with them. They definitely have been, people's opinions have been skewed maybe slightly by what they've seen in the media and on television. But it really is just putting back the volume that you previously had in the right place. And whenever you think of 6 mils volume loss per year, it is amazing what you can do with 1, 2 or 3 mils. So there's a little bit of less stigma associated about it, but we always still want to keep it natural. So we really, with filler, the first thing we want to do is make sure that we never do any harm. And we always want to make sure it's super safe and that the procedures that we start with are really effective. That safety level is really, really high. And they do maybe multiple things like lift, volume restoration, help tear trough, light reflection, get a little bit of shadow under the cheekbone, and then you can you really restore that volume nicely. And interestingly, whenever people come in and their lower face might be a concern, whenever you do just a simple thing like restore a little bit of mid-face volume, of course there's other things that can go on that annoy people, but some of those things sometimes melt into the back of people's minds because they are less, the focus is less on them in their mind, particularly if they're on a wellness program with other things as well, like diet and hormones, etc. So a couple of pictures now, we'll just click through. So just some nice mid-face volumization. She looks a little bit fresher. This lady as well, I think a 48 or 49. And whenever you turn to the side views, they really start to look really nice with that transition from mid-face down into jawline and neck. There's another one really nice there. You can just see that jaw shadow coming in really nicely and some of the laxity in the neck disappearing. Really subtle mid-face, just a little bit of a sculpt. And you can see it on the side view, what I'm talking about, but with that little bit of light reflection and shadowing that comes in there, but hopefully still looking nice and natural. That's the other side there. Lips are always a thing. People worry about lips, but they are part of our facial aesthetics. So whenever I think of lips, I don't just think of lips. I think of how they fit into your whole face and particularly your lower face. And we generally lose, or the lips sort of generally evert and sort of disappear, particularly whenever we smile as we age. And there's no filler in this lady's lips. It's just a little border trick to enhance the cupid's bow. And whenever there's no side view on that one, but you can just see a little, I'll go back, where the distance between the nose and the top lip has started to lengthen. And then whenever we do that little trick, the distance between the nose and the top lip shortens and the chin looks a little bit longer, which is very aesthetically pleasing. Also, whenever we're thinking about lips, this was immediately after the treatment, so it can be quite gentle. But again, never usually think solely of lips because you just want to see how it fits into somebody's overall aesthetic. So a little bit of softening of the nasolabial shadow there can really help with that lower face look, which makes lips look better and more natural whenever you restore the volume in them. Now this one is just a little bit of jawline. Just see that nice little jawline shadow peek in there. So which is quite nice and natural. So it isn't just about where you actually put the filler in. It's we always look at where we put the filler in, but it's all actually about the overall effect it has on our aesthetic. So that's even from the forehead right down. So this lady, lovely facial triangle already with nice mid-face volume, looks okay. Then you get to the side views, then you get to the transition into the neck and it starts to get really nice. And a little bit of a bruise there, so that does happen occasionally. I'll show you another one later on. So we just want to keep it really, really natural. We want to keep the comments of freshness and naturalness, and even a reduction in any negative comments like that you're looking tired all the time, and those comments maybe start to stop, which is a really nice outcome as well. So we still want you to look like you. That's why Shauna calls our clinic, You by Dr. Shauna Watts. But of course, you never have to have dermal fillers to look refreshed, and it's just an option. And if you can explore those options and trust a little bit of the process, then it could be something that you might think about. So other treatments, again, sorry about the formatting. If you just look at the skin booster component here, you just see how this skin has started to freshen up and the texturing has improved, a little bit more collagenization and lift. And then this one I thought was a really interesting one because I'm such a good injector. I never bruise anybody. And this is me doing a little bit of practicing. Gives off a solid black eye there. But if you look at my tear trough on the other side, and that has just settled slightly, and that is PRP, because I have such a healthy diet. My growth factors are amazing. I'm not so sure about that. It's never too late. Some people do worry that, I maybe wouldn't think about embarking on a journey like this, but it is actually never too late to do some very simple things to freshen up your aesthetic. And this lady's journey has been so interesting. After her husband died, she wasn't in a great place, and now she just feels a little bit fresher and better about herself. Actually, she improved even more now with Profhilo, and she was accused of looking in her 60s recently, which is really nice. So it can be quite simple. It doesn't have to be overwhelming. And I just feel that there's always a little formula. Optimize your hormones, use a bit of skincare, enjoy some really nice dermal treatments that work. Think about Profhilo, and then think about other things, not necessarily dermal fillers or Botox. There's Ultraformer, face tightening and facelift, and then we've got our new Alma laser. But it's just something, it's nice to inform yourself of the knowledge and then you can make the correct decision for yourself. Thank you very much.
As someone who went straight from pregnant to menopausal very quickly, my skin really, really deteriorated quite rapidly. Now, I'd always had a sensitive skin, but my barrier function deteriorated and I developed really very obvious rosacea. And this is something that I see day after day in my clinic also. So many of you reached out and asked what I recommend and why. I have to say that since I opened my clinic, I've been using a brand called Rationale. They're an Australian brand that have been around for about 30 years. And what I absolutely love about Rationale is the products. They feel very luxurious, but they're extremely scientifically derived. And they've got these ingredients called skin identical formulations. All the ingredients, the minerals, the vitamins, everything that's included, the proteins, the lipids have all been found naturally within the human body, and therefore they're recognized by the body. So the ingredients are really, really well received. I find that menopausal skins and perimenopausal skins are dry, irritated, and sensitive. And with this range, I'm able to create a bespoke skincare plan for my patients. If you're interested in getting some of these amazing products, head to rationale.com and use the code YOU at checkout to receive some exciting bonus samples with your order.
I've been considering getting Botox, maybe a bit of stuff in my forehead or some filler in my lips. I don't know what the long-term effects of that is. Can she explain that a little bit?
Hi, Alana. Thank you so much for that great question. So let me first start with Botox or anti-wrinkle injections or wrinkle-reducing injections. That seems to be a topic on the tip of everyone's tongue, but it's actually been around for a long time. It's been used cosmetically for over 30 years. So actually we do have quite a lot of long-term data on the safety of it. Some people don't realize this, but actually it was originally being used for a lot of neurological conditions. And one of the conditions it was used for initially was people having a thing called blepharospasm, where they were getting spasm around their eye. And that is a really troublesome neurological problem. And initially they were using Botox injections around the person's eye to reduce that spasm and allow the person to be able to not have pain in their eye, and also for their eye to function normally. And what they noticed was that people who had those injections had very smooth forehead on that side. And the patients started coming back and asking the treating doctor, hey, I'm really happy about what you've done for my blepharospasm, but actually, could you do it on the other side as well? Because I'm really loving that I've got this smooth forehead. And that was the kind of origins of beginning to use this toxin to cause relaxation of the muscle and therefore reduce the wrinkling effect that you have naturally. So basically it has a long history. It's definitely very, very safe. Sometimes people get a little bit confused and think that they can end up with botulinism, but basically you can't. So the doses are absolutely tiny. However, that's not to say I genuinely believe that it is a procedure that should be carried out by someone who really knows what they're doing, because it's very, very easy to potentially have untoward consequences that you don't want to have. And they are things like having, drooping of your eye, or feeling like you've got, a startled look about your face, or having your eyebrows look a little bit strange. So in terms of long-term implications, look, really, there really doesn't seem to be any. As I say, we've had the data for quite a long time, and it would seem that the main long-term consequences is that people who've had these injections for a prolonged period of time seem to have a lot less wrinkles. So most people would consider that to be a bit of a positive impact. Obviously, there are also short-term risks, and I have already mentioned some. So sometimes you can get a cosmetic outcome that you're not going to be delighted or happy with. And the reality is that it does take a while for that relaxation that has been caused by injecting that toxin. It takes a while for it to kick in, but it also takes a while for it to wear off. So if you don't love the results, then the reality is it's probably going to take, anything up to 12 weeks for it to completely come back to normal. One of the most annoying consequences or potential risks with using these injections are to get a droopy eyelid. And that can be obviously extremely annoying for someone, because if your eyelid becomes very droopy, then you're not going to be able to see clearly. It might impact your ability to work or drive. The reality is that consequence is not common, but it's not uncommon. It's definitely a real risk. The good thing is, if you are unlucky enough to have that happen, it tends to be a short-lived consequence. So maybe will persist for 2 to 3 weeks. There are some special prescribed drops that you can be prescribed and that may help, or your doctor may also be able to do another type of injection that may also help reduce the consequence. But really, those are the kind of negatives of having anti-wrinkle injections. It is a very commonly repeated procedure, and patient satisfaction is extremely high with these injections, because people like the response, and people tend to really like it, particularly on their frown line, or on their forehead or crow's feet are probably the commonest places that I see people asking for those injections. So the other part of your question was about a completely different type of injection regarding lip filler. And what people will notice in Australia over the next little while is that unfortunately, because of TGA and APRA rules for doctors and nurses in Australia, it's becoming increasingly difficult to talk about these things in any kind of advertising material. And so you will see people just talking about, I have treatments that could help enhance or plump your lips, but you can't actually use a lot of the terms that were previously used. So trying to find information may mean that you have to kind of go back through older videos, and you might even have to look outside Australia to find what you're looking for in terms of educational content. And that's just because we've had some new rules put in place. But anyway, back to your main question, what are the risks? Well, obviously, if you were to have filler done in your lips, I'm not going to lie to you, anyone putting a needle anywhere near your lips is going to sting and it's going to hurt. So you're going to want someone to use some numbing cream on you ideally. So it's going to numb the pain. The next thing is that you're probably going to be nervous, and the person's going to need to be someone who can put you at ease and relax you so that you can sit and allow someone to work around your mouth area. I think the secret with lip filler is to go and not have lots of preconceived ideas, or not particularly attached to a photo of a celebrity, for example, because you actually might have a completely different type or style of lip. And believe it or not, we've got different names that we call different lip shapes. And the kind of lip that you want because of someone you've seen on a picture may not actually be possible for your lip shape. And in fact, something completely different may suit you. I think the other thing with regards to lip filler is, go really low and slow. So sometimes, because we're talking about small volumes of product, sometimes people think, oh, 1 ml, that seems really small. That's just like a fifth of a teaspoon. And that's not very much. I want more than that in my lips. But believe me, even 0.5 ml in lips, in a certain lip, can be more than enough. So I think you want to really take your time, think really carefully about what it is you're trying to achieve and why you're trying to achieve it. And I think it's also really important that you go and see a practitioner that you trust and that you like their aesthetic or the look that their patients seem to be achieving, because there's definitely some clinics out there who go for a very dramatic look, and then there's other clinics who their patients are really into a very subtle look. And I think you want to be really choosing where you go in terms of what outcome you're looking for. The thing about we use a hyaluronic acid filler to fill lips, or to put into lips. And you do get an instant result. So it is a little bit different to the anti-wrinkle injections that I talked about earlier. The anti-wrinkle injections take days to kick in, whereas you will, walk in with your lips looking one way, and then if you have your treatment, you'll walk out with your new lips. However, I will put a caveat to that and say that your lips will be more swollen as well. So the final result is likely to be somewhere in between. The main complications with filler, or the main risks of filler, obviously, as I said, were the things like, your lips hurting. Someone puts a needle into your lip is absolutely filled with blood, muscle and engorged tissue, so the risk of getting a bruise. So although you can definitely have lip filler and have no bruising, you have to always sort of prepare for the worst and then hope for the best. So you definitely wouldn't want to have lip filler, I don't think, and then be going to like a wedding the next day or something like that, because you may have some swelling. There obviously are some people out there who can end up with, anytime you breach the skin with a needle, you can end up with an infection, you can end up with a reaction, you can end up with a nodule, and you might just not like the result. The good news is that with filler, you can use another product to dissolve most fillers, so you can go back and have it reversed if you would like to. But basically, in summary, I think that all of these treatments needed to be treated with the respect they deserve. They are medical procedures. I don't think that they're something that you should go and have on a whim. I think they're something that you should think about. You need to understand that there are potential consequences, and sometimes they can be serious and potentially, life altering. And therefore you always want to know that you are going to somewhere that's really safe, safety conscious, and that you feel comfortable that they are on the same trajectory as you are, in terms of that you both want the same outcome. Alana, I hope that's answered both your questions today, and hopefully some of the listeners will have gained some knowledge as well.
Tim, I'd love to take a step back, because some of the patients that I see, and I know that many of them who will be listening, actually are quite uneducated. They even struggle with what is the difference between, wrinkle reduction injections versus dermal fillers. Would you be able to explain what those are and why you might pick one or the other or both?
So in terms of muscle relaxants, botulinum toxin, you're relaxing the muscle that causes the wrinkle, and you're relaxing the muscle that pulls the facial feature downwards if you want it to go up. So you can subtly affect the resting position of certain features. It's mainly eyebrows, but the corner of your mouth, and some of the dynamic attributes. So the way your face moves can be improved by relaxing certain muscles, and that's done with a protein that essentially temporarily disrupts the message that comes from your nervous system to the muscle to cause it to contract. And that then allows the skin to recover, for wrinkles to soften, and it allows certain facial features to alter position because untreated muscles subtly pull features in the opposite direction when you've treated the treated muscle that's in pulling the other direction. That's essentially how that works. It takes 3 to 4 months. You might be lucky and get longer. Sometimes you get a bit less. But the result, it's very, very safe. All the side effects are temporary. And as long as you buy products from reputable places, you will get scare stories of people getting botulism, but they tend to be, shopping from strange places rather than directly from the manufacturer, which is what I always recommend a good clinician does, or at one of the big pharmacies. In terms of dermal filler, there are all sorts of dermal fillers, and it's worth reflecting on which ones you're getting because they all have different pros and cons. I'm a very cautious practitioner who likes the ability to go back from where I am, so I only use reversible products. But there are some attributes that are some reasons why you might use a reversible product in some people. And essentially, what a dermal filler does is mostly you can use them at multiple different layers of the skin, and they can soften wrinkles, they can alter the contour and the shape, and they can replace volume. And to a very small degree, I believe they can cause a small lift, or at least a strong appearance of the word of lifting. And so you can instantly look fresher, younger, and more beautiful if it's done well. But it's very artistic. It's not so much about the product. The product's important, but you also need to have someone who's taking your face and the whole context into consideration in order for you to get a good result. And most people have it. They get many years of benefit over time, but it needs to be considered as a long-term thing where you're making adjustments according to what you see every 12 months or so, and not just going to different places. You just put more in. You need to be taking that overall approach. Otherwise, you will end up looking, if not overtreated, just slightly odd, because it's sculpting essentially. It's sculpting a moving target because you also don't lose the volume in the same way in the same places. So that's essentially it.
Yeah, no, that's great. And what's your thought on the migration of filler? Is that something that you think happens? Does it go on the move?
I think the bulk of what you see is more diffusion. So if you inject a product, and I do think there's big differences between products, but I can't tell you which. Unfortunately, it's not very well researched, and also some people respond differently. But if you inject a line of filler, it's a bit like putting tea bag into your tea. It slightly, even if you don't stir it, it will spread out slowly, but it doesn't kind of go traveling around to different places. Certain areas with high volumes, you see collections of product. So if you have your lips treated again and again without respect to the previous treatment, you might start to notice that some areas it gets squeezed out of, and other areas it remains, and you just end up with a slightly distorted appearance. I think it happens anywhere where there's lots of movement. It's not quite the same thing as just I think migration sounds like it's literally crossing borders, going into new places, and I don't think it's quite as strong as that, but it's enough that in high sensitivity areas, particularly around the corner of your lips, you can see it. So that's the biggest area I think people talk about it. Tear trough is the other one. But if you look closely at people's faces, I saw a chap who'd had his nose done 6 years ago recently, and it was still better than how he started, but it also started to expand instead of shrink. So his nasal bridge was just slightly fuller than the picture that I had when I first treated him. And as long as you're open and honest and talk about it, it's very easy to solve. So that you just need a way out of it. But it's more of what I'm basically saying is it hadn't moved to another part of his face. It had just expanded. And I think that's what you're dealing with most of the time. And you want a product that you can reverse for that reason, and a product and a clinician who's paying attention to all of that. And it's an adjustment every few years normally that you need, not like every 3 months. You have to reverse it.
And is there any types of patients that you think should absolutely never have dermal filler?
Well, first comes to mind are the kind of psychological attributes. So some people, they're essentially trying to solve much bigger problems with a a distraction. I don't know. I remember breaking up with my girlfriend when I was 18, and I immediately started to grow a goatee. Let's see if I could grow a beard. I couldn't at that age, but I remember thinking, I've always thought of that, like it was a distraction. I was trying not to think about the pain I was in by doing something so that I could think about that instead. I think some people, there's a wrong time to do it, maybe the right treatment, but the wrong time. And some people, they essentially are never going to be made happy by the treatment. That's how I consider body dysmorphia. Is it doesn't matter what you do, you never get the relief that the patient thinks they're going to get, and in fact, it can make them worse. So that, and I think it's a bit harder in practice than with the questionnaires to decide who's got body dysmorphia. But essentially, the acid test is, do they look better but feel the same or feel worse? Then I would never treat them again. And if they've had that experience in the past, I would have a conversation about whether this is the right avenue to look to actually provide them with the relief that they want. But it's tricky. That would be the main one. The other one would be acute times of your life is not a good time. So recent deaths, breakups, all those kind of things. But there is a period, I just also want to say, like a bit beyond that, where it's actually quite healthy. Like you've had a divorce, you've been miserable for 8 months. You're starting to feel a bit better and you're thinking about going out more. That's actually often the perfect. You're on the front foot again. You're trying to restore things. So that's a bit different. I don't want to put everyone off because there usually is a trigger. You just don't want it to be too acute. And then there's some physical things, but very few of them. So mainly it's any time when you have a lot of medical uncertainty, then it's probably a bad time. So if you're going in for surgery next week, probably not a good time. If you have an autoimmune disease that's inflamed or has been inflamed 2 months before, and you're hoping it's okay, but it's it's a bit touch and go, probably not a good time. But I would say inject Botox is quite simple, but similarly, if you're very worried about things, I'll give you a story to bring it alive. I had a patient who was incredibly worried about blindness from dermal filler, and generally it turned out. And I took dermal filler off the table, and then we decided Botox would be easier. She was still anxious, but I'm very, very good at reassuring people. So I give all the explanations. I come across as calm. I got her through to the point where we could do one area of Botox, thinking that's not going to cause any problems. And anyway, she had her treatment, took one step outside the clinic, called an ambulance, and went to the eye hospital because she was so anxious about her eyes. So in retrospect, I shouldn't have treated her because she was so anxious. I was making a rational assessment that this is not a risk, so I can do it. But her emotional state was so bad that she ended up in hospital anyway. Which she obviously got discharged because there's nothing wrong with her, but except for anxiety. But that would be another thing. Like, don't do it when things are chaotic in your life.
Yeah, absolutely. And Tim, I know that you're very passionate about having a thorough facial assessment before you would progress with a treatment. What does that look like for you, and why do you take that approach?
So I mean, the biggest difference with me is I think the facial assessment is just one of the diagnoses that we make. So I want to know what the patient's story is. I want to know where the friction point is in their life, and I want to hear the things that they say to themselves and the things that people say to them, because only with that can I actually do a proper facial assessment, because you're trying to relate what you see to a social friction, which is people say I look tired, or it's like whatever the term, doesn't really matter. But then I have the context to look and diagnose what it is on the face that's causing that social disconnection. So in terms of what I do then, I think some clinicians, it's quite hard to listen to. They describe it, and some hairdressers do this as well. I've seen more hairdressers myself than clinicians, because all my clinicians who I've trained would never do this. But the hairdressers, I don't know if you've had this, they kind of pick your hair up and they go, oh, what shampoo do you use? That's terrible. And who cut this last? It's always like, so some people do that with faces, and they'll say, this jowl, you're going to have to do something about that. And you've got this deep shadow under your eye, and that's going to need fixing. And it sounds hard to listen to. So I try and make my facial assessment pleasant and empowering. So you would normally start with a compliment, like what is actually good? And there's always something good. And then I give them some education on what a healthy, happy face looks like. So we talk about framing and projecting points, and why, I'll use a good asset often and say, you have beautiful details around your lips or your eyebrows, frame your eyes nicely. And this all that you're essentially trying to educate them on what a healthy feminine or healthy masculine face looks like. which then gives them context to hear the opportunities to improve it. And I'll ask for permission multiple times. So once I've given them I call it Aesthetics 101, I'll say, is it okay if I actually talk you through the areas of potential that I think you could make little tweaks? And then I give them permission to reject everything and anything that I say, because I want them to feel in control. So I will say, now I might be able to correct something, but I want you to feel like it will make you feel better before we do it. And if anything I say to you sounds interesting, but you don't get why it's going to make you feel better, then we'll just take it off the table. So there's a constant invitation to remove things. And I will also do the same when I'm assessing. I'll say, you do have a tiny wrinkle there, but I know enough about you, if I know their budget or their goals, to say we should just ignore that, because that's not really going to make you happy to get rid of that. So I'll actively take things off the table when I think is appropriate as well. And this is just trust building. And then then we can systematically go through the face, and I'll look at the top third, middle third, and lower third, and I also divide it into quadrants. So I don't ignore the most lateral, the middle, and obviously the central component. A lot of people forget to assess the nose, for example. So I always say divide it into 9s, systematically describe the good things and the opportunities for improvement, and then piece it all together at the end with many opportunities for the patient to feel like because the patient fears it's a trap, that they're going to be told they have to have everything you've mentioned. So I'm constantly saying it's just an overall assessment, and then we'll decide at the end what's going to make you happy. And I think that's important. Otherwise, either you end up spending money on things you don't really want and risk, which is the worst bit, or they get defensive and don't have anything and go away and think about it when they actually wanted something. So it's important to make people feel safe and cared for while you describe all these details. In terms of how I describe it, I'm using a framework now where I describe the defining points. So every face, if you have a look at a face, it's defined often by the hairline, and then there are certain key points. So eyebrows, position the apex of your cheek, the apex of your chin, obviously the shape of your lips and the projection of your nose, your jawline, your gonial angle. And you can work through each of those defining points, and then they're also connected together. So your chin is connected to your gonial angle, your cheek is connected to the, also by a line that runs to oral commissure. And you can use those lines and projections, and then there are surfaces that connect the lines together. So I will describe it in that way, particularly to clinicians more than patients, but so that they understand I'm creating a 3-dimensional structure that we're trying to make beautiful and resonate with other people's brains and their brains as the right shade for a human face, which is essentially what we're trying to create.
Tim, what do you think about the women? I'm sure that you guys have the same patients at times that I have, who feel quite guilty. So they will come in and they're maybe a mum who hasn't really put herself first for years, and then they've perhaps gone through menopause and really felt like they've suddenly aged, but they're almost apologetic because they still feel a lot of guilt, that they feel like they want to look nice, they want to look better, they don't want to age, they don't recognize themselves in the mirror anymore, but they almost feel guilty that they shouldn't care, and that it makes them superficial, or it makes them a shallow person because they care about this. But what would you say to anyone listening who has that kind of barrier in their mind?
So the best thing I say is actually more about questions. I want to know the context of their life and their treatment. The first patient I ever saw was relatively young, had a young child that didn't have the best clothes on. I remember thinking, should she be spending the money on this? So I had a little bit of that judgment in it, and I thought about her quite a lot as well. And she was working in a pub. She was front facing, but she was also single at that time. I remember over time thinking, who am I to say that her looking after her appearance is not going to lead to an interaction that then leads to a new relationship and a new life? Because, if you're young and you've got a single mum, meeting the right person can make the world of difference to you. So I always try and look at people in that context, but I don't think patients do that. So I would ask them questions that would help them realize that this isn't just about your appearance. Because tell me how you feel. I often use good hair days. How do you feel on a good hair day when everything's on point? What kind of person are you on those days? Do you smile more? Do you feel like you can pay more attention to your children because you're less stressed out? And you'll find that people maybe if they've never looked after themselves, they may not know it. But basically, when you feel taken care of, you immediately stop thinking about yourself and you start to think more about other people. And they actually do more looking after of other people in a way that's freer and easier. And that's usually what comes out of it if you get them to pay close attention. Now, it won't be true with every person, but the average mum who has looked after herself will look after her children, certainly in a freer and easier way, because they're less stressed out. So, and then if you ask them to pay attention to that, they will also observe it. And that's usually the end of it, when they say, you know what, I felt great. I remember going to my kids' school thing, feeling really confident, whooping when they were on stage or whatever, and whatever it was that they could put more of themselves into the world. Because that's really another way I describe it, is we want you to put more of yourself into the world. And that's a good thing for the world, because you're trying to do good work and look after your kids. So that's how aesthetics tends to work, when done on the right person correctly, is that they feel more able to project themselves into life, including their kids.
Yeah, I agree. And I think the other flip side of it as well is, unfortunately, in medicine, I think there can still be quite a bit of snobbery in medicine, that aesthetics isn't real medicine, and, that we're not sort of saving lives and all that kind of stuff. And it all feeds into the psyche of everyone feeling like it's all a bit like embarrassing or whatever. So I just think it's very interesting how the clinician can be made to feel one way, and the patient can be made to feel guilty for actually wanting to care about what they look like, that in some way it's making them superficial. But I agree 100%. I know that whenever I've had my hair done, I can conquer the world.
That's the heart of the deepest philosophical debate in this whole sector, is your appearance part of your health? And I think it's really obvious if you pay attention and you consider that health is not biological failure. It's not like you're a heart attack or a clot in your heart that stops you from living. It's the fact that you hold yourself back psychologically, and people are distracted by the blemish or whatever it is, and that stops you forming healthy relationships that you could form. So as long as you start to see health as both psychological and social, and not just biological, then aesthetics is very clearly part of health. But almost no one in that highly technical field, if you're a brain surgeon, you just may not think that way, and you need someone to explain it to you differently. But this is why I would rather we start to think of ourselves as experts on human connection, rather than experts on what people look like, because that's what people look like as a tool for connection. And if you start to think of it that way, maybe even rebrand it one day, I don't know, then maybe more people would understand that what it really is, because it isn't about how you look, it's about how you feel and connect, how you're received. It's different.
Yeah, absolutely. And like you said, the patient who's recently divorced and, has gone through their heartache and kind of coming out the other side, they are ready to have a bit of confidence to go and conquer the world and maybe go on that date that they've been putting off. So I think it can be really transformative.
This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.